The 2SLGBTQ+ community has its own unique healthcare and mental health challenges. There's a clinic in Toronto that's innovating like nowhere else in the world to make it easier to access the care they need. How being centered on care prioritized the well-being of the 2SLGBTQ+ community.
So there's a lot of challenges that people in the 2SLGBTQ community face when trying to access care. So first of all, you want to access culturally competent care, practitioners who understand you and where you're coming from. When we talk about sexual health testing, there's delays in terms of getting those results, so it can take a week to 2 weeks for results to come back. And that can lead to a lot of stress, a lot of anxiety when people wait for results, wonder if they're going to get the results and when it's going to happen. So here at HQ, we've really tried to change that to provide those results very quickly, so within a business day of people getting their test. And that's really revolutionary for Canada and really the world in terms of the speed of access to care that these individuals can get. Let's take a look at how we do that here. So when someone's actually been to HQ before, they're able to swipe their health card. The kiosk itself is available in 15 different languages. The system's going to ask them some simple questions around their health today if they need to see a practitioner. If not, if they just want testing, then labels will print out for their specimens. They can go and collect them in one of our self-collection rooms. All of our testing is done here on site, so after someone's collected their samples and dropped them at the lab, we're able to process their HIV test, syphilis testing, chlamydia and gonorrhea, with results available the next business day for individuals. Once someone has gotten their labels printed out from the kiosk, they can come into one of our express testing self-collection rooms to do their tests. People can grab their swabs and then watch one of our videos that actually explains how to do, for instance, a throat swab.
How to do the oral swab.
So once someone's collected their specimens, then they'll come and drop them off through a drop box. It'll go into the laboratory. Then they'll go back into the waiting room and our phlebotomist will call them to do their blood tests. At that point, the clinical team will actually review the test results and then we'll send a text out to the patient, either saying they need to come back to clinic to talk to the clinical team, or your test results are in, there's no need to return to clinic, all of your tests are negative.
So we knew that the sexual health services could be innovative, and we also knew there was a huge need for mental health services within our community. The higher rates of suicide, the more common problems with mental health and substance use meant that we needed to put these services in the same space so we could innovate, and to have group rooms so that we could implement a stepped care program. This way we could match the intensity of services to the intensity of problems people are presenting. The social and recreational activities can now be integrated to the same space, and so we can have yoga nights here, there's a gay men's coffee night, and we've built the space so that there's high ventilation so that there can be ceremony for Indigenous community to smudge in the rooms that we have available.
Dr. Guimond and Dr. Woodward are providing groundbreaking care to the 2SLGBTQ+ community that addresses their unique healthcare needs in an efficient and easy-to-access way. The future of healthcare is looking more promising because of them. Sign up to show your support for the work of Ontario's doctors.